blood flow turbulency and laminar? Yes. This is dastata. So before starting and continuing our topics regarding circulation, please let's review important parts. What do you remember from Thursday's discussion about circulatory system?
The circulatory system is starting from the heart and rest of the adaptation. For example, we have with the pregnant, there is become high, the radius of the artery or the vessel is become high, and the resistance become low, such as the Ohm's law, and we have two types of the blood, such as turbine or
Laminar?
laminar, and we told that the blood cell which is near to the air becomes slow, and in the middle is becomes so fast, and the factor that affect on the resistance, such as the area, such as the air, the eta, and a lot of.
So I want one volunteer to write one equation that we discussed Thursday. If you remember, we have two equations, Ohm's law and Poisson's law. Who is ready to write on the board one of these equations? You don't remember anything?
Just write it.
Right,
No.
one of them.
Yes.
Okay. Okay, thank you. So, based on this formula that given from Ohm's law, we are saying that pressure and flow always directly proportional to each other, flow and resistance indirectly proportional to each other. We have another formula. I need another volunteer.
Maybe say
Yes. 8. And thank you. Thank you. So again, based on this formula, we can see pressure and flow again directly proportional with each other. The radius to the power of 4 directly proportional to the flow, and two other factors has an indirect relation, length and viscosity. I want you to remember these two formula for the circulation, for the finding the flow in any vessels. What else? We talked about two different flow, turbulency and laminar. I said that laminar flow is mostly seen in our vessels because our vessels trying to push forward the blood flow. Laminar or layer and layer movement can slowly and smoothly send blood forward. And what else?
The total cross.
Total cross section and velocity inversely proportional. Thank you. And we said that we have different types of arteries, muscular artery.
Elastic wall, and the
Yes.
resistance is low,
Mhm.
and so the pressure is high, and the blood flow is. And for the small arteries,
Yes.
and the resistance is high, and blood pressure is low.
Yes. Small arteries or muscular?
Muscle wall.
Yes, excellent. And we know that from the aorta into the vena cava, always the pressure starts to drop. From the
by concentrating to the
aorta, we have highest pressure, 120 to 80. The average of that is 100 millimeters per mercury. Into the vena cava, the pressure starts to drop. So, any question until here? Excellent. In the vessels, we should find in which situations the flow will be turbulency or laminar. Based on this, a scientist named Reynolds, Osborne Reynolds, was a scientist, find an equation to anticipate that the flow will be turbulent or laminar. You can see that equations as a Reynolds number. This equation. Rho Vd, rho as a density, V as velocity, V as diameter. Divided into eta viscosity. So rho Vd into viscosity, if we put all these factors digit, then we have finally one number named Reynolds number. If this Reynolds number, my dear friend, is more than 1,000, if Reynolds number is less than 1,000, we said that that flow is laminar. If it is less than 1,000, we said that that flow is laminar. We can anticipate by this Reynolds number. If Reynolds number is more than 3,000, we said it's turbulency. So we can calculate Reynolds number and we can see if the Reynolds number is less than 1,000 as a laminar flow in that vessel. If it's more than 3,000, we said it's a turbulency. Between 1,000 and 3,000, we're having a transition zone. Sometimes we are having laminar, sometimes we're having turbulency, transition. Transition zone. It means that laminar and turbulency are converting to each other after a while. The definition of blood pressure, as you are seeing here, that blood pressure is the force that the blood are pushing the forward or the wall of vessels. And from the physics concept, we know that any molecules in area can produce a pressure, that this pressure named pressure to the area or to the surface of the to the surface of that part. Let me show you by an example to remember from physics concepts. In this jar, we have some molecules of air. These molecules of air are pushing wall of jar. The amount of pushing of these molecules named pressure. Obviously, if I reduce the volume in the jar, as you are seeing here in another picture, if I reduce the movement and the accidental moving of these molecules, the molecules are same, but movement are going to be increased. And we said the pressure in the low volume will be increased. And based on that, we always know that when the volume decrease, the pressure always increase. It means volume and pressure always inversely related with each other. So we have pressure. The same definition of pressure are inside the blood. When you are talking about positive pressure, it means that it's positive. When we are saying some pressure is positive, it means that it's plus the area's pressure. For example, if I told you that systolic pressure is 120 millimeter of mercury, it's plus the air's pressure. For example, air on the sea level is, air's pressure in the sea level is 67 millimeter of mercury, sorry, 76. One atmosphere. We said air's pressure on the sea level is 1 atmosphere. Yes? Is 76 millimeter of mercury. 760 millimeter of mercury. So, when I told you that the systolic pressure is 120, it means that systolic pressure is plus 760. This is, I mean that when I'm talking about any pressure, positive or negative, you are measuring in comparison to the air's pressure, okay? In some cases, maybe, especially in the respiration. In the respiration, when we say the chest cavity's pressure is negative, it means that it's negative in comparison to 760 millimeter of mercury, okay? For understanding better and simplifies the digits, we always consider 760 millimeter as a zero. Okay, so always we are talking about negative pressure or positive pressure or equal pressure. I mean that we are comparing it based on air's pressure. Okay, so this is the main thing in the physics that we are doing this.
What does positive 100 mean? Positive 120.
It's positive, yes.
No. 120, what does it mean?
Systolic pressure. Systolic pressure. For example, when I tell you the systolic pressure is 120, it means 120 plus 760 millimeter of mercury is there. Okay, it means that our body's pressure is always positive. Okay, because our body's pressure our body should keep our pressure as positive to be in this high pressure, like 760 millimeter of mercury. Okay, and then in the continue, let's talk about different circuits in the vessels. It's again related to physics. If you remember, in physics we have two different circuits, series and parallel. We said Mutawali and Tabori. Yes. We said we have two different types of circuits in physics, and in the vessels we can see we have the same type of circuits in here. For example, imagine that aorta, imagine this connection, aorta with large artery, for example, kidney artery, and kidney small artery, kidney arteriole, kidney capillaries, kidney venous, and kidney veins. I'm telling that all of these vessels are connected as a series circuit. Yes, it's series circuit, continues with each other. Aorta, large artery, small artery, arterioles, capillaries, venules, and veins. They are continuously each one after each one, so we say that as a series circuit. So another example, circuit, parallel circuit, is connection between brain, heart, kidney, GI. All of them are in parallel circuit. So we can say we have series circuit in our body and we have parallel circuit. In the series circuit, total resistance, if you remember from physics, in the series circuit, total resistance is equal to resistance of each part. Yes, total resistance is equal to resistance of each part. For example, if we add extra part to this circuit, what happened to the total resistance? Increase. Increase, yes, total resistance, summation of each resistance, as you are seeing in the upper part. But in the parallel circuit, total resistance is 1 to the each of them. It means that, let me ask you one question. What happens if we remove one part in the parallel circuit? What happens to the total resistance if we remove? Again, in the parallel circuits, as you are seeing, what happens if we remove one part to the total resistance? Increase. From physics, we should remember, increase. If we remove one part from the parallel circuit, total resistance will be increased. And in contrast, if we add extra part into the parallel circuit, total resistance will be decreased. It's because it's the reverse of each of them. Okay? You can calculate, you can put any digit and calculate. It's your basic knowledge. So, that's the reason why if somebody has a surgery and imagine one kidney removed from the body, and because of this, what happened to the total resistance? Total resistance increased. Total resistance increased, and I told you that always our body trying to keep blood flow as a normal range. So total resistance increased, blood flow decreased. To compensate the reduced blood flow, our body trying to increase blood flow by increasing pressure. That's why during any kind of this type of surgery, when some part of body are removed, because of these connections between organs, the total resistance increased, blood flow reduced. To compensate reduced blood flow, our body trying to increase pressure, and that's why after any type of this this type of disease, the patients should be monitored to hypertension. So chance of hypertension may be increased in that case. Yes? Another thing about these circuits for the series circuit. From the physics, we should remember that what happens if we remove one part from the series circuit? The whole system will be destroyed, yes? If we remove, for example, capillaries from the series circuit, the whole system cannot work properly. The whole system destroyed, yes, in the series circuit. But what about parallel circuit? Yes, in the parallel circuit, imagine somebody has brain ischemia or somebody has no perfusion in the brain and brain circulation removed from the body. Because heart pacemaker is working and heart is making systolic pressure, it means that the whole system is worked properly and the perfusion in the whole system is still remain. That's the basic of organ donation. When somebody has brain ischemia or brain circulation removed, brain injuries happen, brain circulation removed, because the whole other organs are connected by series circuit. Other organs can perfuse normally because the heart are sending the same systolic pressure as normal, and it means that the other organs are alive. Yes?
If someone has kidney transplant, so the resistance is
Decrease, obviously. So that's the basic of this connection of different organs with each other. Any question? Yes? Okay, please at first let this slide, and we will, at the end of today, I will tell you about how we measure blood pressure. My dear friend, here you are seeing that we have a blockage in point C. In point C, we have a blockage. Imagine that this is a vessel and we have blockage in point C. Before point C, the flow is laminar. And during point C and after point C, because the diameter increase, we are seeing that laminar flow change into the turbulency. In this area, we have turbulency. It is a basic of blood pressure measurement by non-invasive method. By non-invasive method, we always block one large artery and then try to open gradually. By opening, the laminar change into turbulency, and we are hearing this turbulency by stethoscope, by the medical stethoscope. That's the basic, this shape is the basic of auscultatory method for the blood pressure measurement. We will see in the next slides. Okay. So, any question until here? We continue with what we want to talk about pulse pressure and some feature of vessels as named compliance and distensibility. And at the end of today, we are going to see how we can measure blood pressure by non-invasive method. I will tell you the theory of that, and in the practical part, tomorrow you have a practical.
Yes.
In the practical part, we will do this by manometer and we will work with stethoscope. So, my dear friend, the book in chapter 15 are talking about compliance and distensibility. This is two definitions, compliance and distensibility. At first, let's see compliance. Compliance, if I want to tell you in a simple way, it changes in volume into changes in pressure. Delta V divided into delta P. When when any part, when a vessel has a high compliance, it means that the delta V must be very large, but delta V very small. It means that the changes of, we can change the volume in a very large way, but the pressure, it must be changed very little. This vessel considered as a high compliance vessel. Yes? High compliance. Delta V to delta P. When a vessel has a high compliance, it means that we can change volume very much, but the pressure change is going to be very little. And between veins and arteries, veins has a high compliance. Veins has a high compliance. Or another name is capacitance. Compliance or capacitance, both of them are same. So compliance or capacitance is delta V to delta P. In parallel with compliance, the book are talking about another definition named distensibility. Distensibility, and if you see the formula, the distensibility's formula is so close to compliance. But as you are seeing in the formula, the distensibility are talking and measuring compared to original volume. So comparing to original volume is showing delta V to delta P. Comparing to original volume is showing the vessel's distensibility. Again, between arteries and veins, veins has more distensibility. So veins has more compliance, veins has more distensibility. If I want to tell you by an example, compliance is imagine like a big barrel, plastic, a big barrel. Yes. So this big barrel has a high compliance, isn't it? Yes, high compliance. But does this barrel has distensibility? No. In comparison to original volume, we cannot inflate barrel. So this barrel has high compliance but low distensibility. Yes? So another example is the balloon, a small balloon. Empty small balloon has a low compliance. Yes? Has a low compliance, but has a large distensibility. We can inflate, we can blow air into that balloon and inflate it 5 or 6 fold more than original volume. It means that we can increase the volume. It means that it can be more distensible rather than, for example, that barrel. It says sometimes they are like to each other, but sometimes they are not. It means that don't get confused. I'm talking about that distensibility related to the wall of any vessels, okay? Distensibility related to the wall, but compliance is talking about the original capacity of any vessels. So, in general, the veins has a high compliance and has a high distensibility, and we can put a large amount of blood volume into the veins without high changes in the pressure. Yes. So that's why we always targeted veins to inject blood, for example, during bleeding, during any situation of hypovolemia. We always find veins. Vessels, we always find one way to inject. Or if we want to take blood, again we are using veins. So we always using veins to add or remove blood from the body. You can see this picture, my dear friend, to better understanding the topic. I ask you to see the x-graph, x-axis. X-axis is showing the volume of blood. Y-axis, can you see the board? I can turn off this line if you want. Okay? Turn it off or not? No? So, the x-axis is talking about blood volume. The y-axis is showing pressure. So, the red line, see the red line, my dear friend? See the red line is the changes of volume into pressure in the arterial system, in the arteries. So, the black point, my dear friend, the black point is showing normal arteries volume and normal arteries pressure. As you are seeing here, if we put this point connected to the, if we connected this point to the x-axis, for example, the volume, it means near to 60 or 700, 6 or 700. And if I put to the y-axis is 100 millimeter of mercury. What does it mean? It means that in this black point, if we have 700 milliliter of blood, this 700 milliliter of blood producing a pressure equal to 100 millimeter of mercury. What is the 100 millimeter of mercury? 100 millimeter of mercury is average of 120 and 80. Okay, so the average pressure. It means that the arteries normally have pressure like 100 millimeter of mercury, and when they have this pressure, amount of blood inside the arteries is near to 700 milliliter. Clear? So, I ask you to, by your mind, imagine based on this graph, add 100 milliliter extra blood volume into the arterial system. Tell me what happened to pressure. Add 100 milliliter of blood into the arterial system. Increase. Yes. Increase, but it's so much, the amount of pressure is very, very high. Come see it, because the shape of graph, if I add only, for example, 100 milliliter of blood, the pressure will be increased near to 140. The pressure changed from 100 millimeter mercury to 140. It's a very, very huge changes of pressure. If we only add 100 milliliter, what happens if we add 500 milliliter? It increases way more, and it's not possible to us, to our body, to tolerate this high pressure. It means that we are not allowed to add or take blood from the arterial system. If we change arterial system, even in 100 milliliter or even in 50 milliliter, we have a huge differences in pressure. That it's not good for the vessels and pressures and resistance and other systems of our body. But see the blue line in this graph. Blue line is showing the changes of volume and changes of pressure in the venous system. The black point, if you send the black point into the x-axis, is showing that the amount of blood volume in the venous system is near to 2,300 milliliters. Yes, 2,300 milliliters. And if we connect that point into the y-axis, the pressure in the normal point must be around 3 or 4. 18?
18
No, it's not very low. It's not 18, it's very low. It's 3 or 2, 3, 4 millimeter of mercury in this point. So, again, can you tell me what happened to pressures if we add 200 milliliter of blood into the vein system? Maybe not increase even. In the 1 or 200 milliliter of blood, we see no changes in the pressure of the veins, because as you are seeing, based on the slope of the graph, we can have a huge change in x-axis, but y-axis change nothing or a little. So that's why we always target vein system to add extra blood volume or blood or even normal saline we are injecting into the vein. And otherwise, if we need to take blood, we are again finding vein system to take blood. That's the reason why we are stopping, why we are saying that veins are blood reservoir. In that situation like bleeding, what happens during bleeding?
concentration is low. The volume of the blood is low. So the pressure is decreased.
So blood volume is low. So if the blood volume reduced, blood volume in the arterial system reduced too. So vein system trying to send the most part of blood volume into the arterial system to keep arterial system's volume as a normal, to keep the pressure of arterial systems normal. And we know that veins changes of pressure is a very, very low, and because of that, we said that veins as a reservoir. It means that during that kind of demand, such as hypovolemia or bleeding, veins blood can shift into the arterial system to keep arterial system's pressure in a normal range, and the veins pressure is not changed very much. That's why we always target vein, and always veins can shift its blood into the arterial system or other system. That's because vein has a high compliance and has a high distensibility. Any question? Okay.
So, in the vein, when the volume is increased, the pressure should increase because we have the
Should increase, but you can see it's the high, veins has a high compliance, so the changing in pressure is not so sensitive to us. Okay? But in comparison to vein, you saw the arterial system. Our body easily can change arterial system's pressure because the lower compliance. Okay? Any question? So, do you need break? Yes, okay, let's have a break. For 10 minutes.
اللي يريد باكر يعني يسوي له
14, 15, 16, 17.